When should I go to the emergency room if I have COVID? I'm ER Dr. Larry Burchett, MD, on the front lines of this COVID thing. That's probably one of the most common questions I get from friends and family when they get COVID. I've seen hundreds of COVID patients in the ER, and I'm going to give you 3 tips and rules for how to approach this of when do you go to the ER when you get COVID. Number 1, this is what I tell every patient that I diagnose with COVID. Come back if you're short of breath. It's very common to feel terrible with COVID symptoms, including headache, fevers, body aches, to be really tired. But it's when you get short of breath that I worry you could be developing COVID pneumonia, where your oxygen level goes down, and that's the window where we need to intervene to give you the medications that can make a difference in your outcome and preventing things from getting worse. So number 1 is, without a doubt, you need to be evaluated if you feel short of breath. I would do more than just put the little oxygen thing on your finger, because that thing is notorious for being wrong. So at least you need to call your doctor. You need to call a teledoc doctor and be seen on a video chat. Or really, if you're short of breath, most people need to go into the emergency room and be evaluated, where we put the thing on, we put the pulse ox on your finger, we look at your oxygen level, your pulse, listen to your lungs, evaluate how you're breathing, how fast you're breathing. Are you labored? Is your skin blue? Is your lips blue? All that stuff, which would be signs that you're not getting enough oxygen. So number 1 is shortness of breath. Number 2, the most common thing that I have seen besides shortness of breath, where people need to be in the ER from COVID, is because they're having a tremendous amount of vomiting and diarrhea. Don't forget, numbers say up to 20% of people may have intestinal symptoms. So it's like a stomach bug that's causing vomiting and diarrhea. Some people, it gets really severe where they can't keep water down. If you can't keep water down and you're getting more and more dehydrated, you're going to have to come into the ER, not just to get checked, but for hydration, where we put an IV in, we can give you a bag or 2 of saline. Your tank is empty, fluids are on low. We can fill you back up, in addition to checking and making sure you don't have a more severe form of the disease. But that treatment can be very helpful for somebody when they get severe symptoms like that. And I've seen a handful of people that come in with GI symptoms that really did need to be there for treatment. Those are the top 2 symptoms that I've seen that I want to encourage you, if that's appropriate, for you to go in. Now, the third one is just a general thing that I think most people will be able to recognize, and that's if you're super sick. Things like confusion and altered mental status, so weak that you can't get across the room and go to the bathroom. These kind of things, seizures, like similar to what we were talking about before, like vomiting so much that you can't keep fluids down. All of these things are such severe results of this infection. I think it's intuitive for most people that they would need to go into the ER and be checked. Make sure everything's okay, your oxygen level's okay, your electrolytes on, or if you don't need fluids, and you don't need to stay in the hospital if your oxygen level is low, and get appropriate treatment, including oxygen and steroids and remdesivir and all of that stuff. So those are my 3 things: shortness of breath, vomiting and diarrhea where you can't stay on top of it and stay hydrated, and 3, if you're really, really sick. Now, I want to say something else about if you have these symptoms, what can you do short of going to the ER? Number 1 is call your doctor. A lot of people have access to their doctor. Talking to somebody on the phone who's a professional, maybe a triage line, I think that's a good place to start. You got to be careful with Google because it just isn't personalized to you. So I would caution against that. I think it's fine to get some information, but I would definitely recommend talking to a person, whether it's your doctor or a line. Number 2 is we've got these video teledoc type interactions now. I think those are a decent thing to do for screening. You don't necessarily have to rush to the ER always. Sometimes you can have those conversations and they can guide you through the next step. And sometimes it is going to the ER. There is no shame about that. That's what we're here for, is to evaluate people. Most of what I do in my job, honestly, in the ER is evaluate people and reassure them that they are okay, that your oxygen level with COVID is all right, that your electrolytes look okay. You don't need any fluids. You don't need antibiotics for COVID. They're not going to make a difference. and you don't need to stay in the hospital because your oxygen is fine. So there's a lot of value to going to the ER and getting evaluated and getting that reassurance, even if it turns out you don't need to stay, you don't need any specific therapy. So I would never shame anybody for coming in for that when they're worried in the middle of this pandemic where it's easy to get scared of COVID. I hope that helps. As always, take care of yourself, stay safe, stay sane, do your part. This vaccine's going to end this pandemic.